Warning, this episode of Twisted Tens contains graphic educational content involving infants born with severe birth defects. The suffering and death portrayed in this video may be disturbing to some viewers. If you feel you cannot handle this, we advise you leave this video now. Giving birth to a healthy baby is one of the biggest hopes in a new parent's life. However, the thing about hope is that it's subject to tragedy. This week, Kaylee Elise joins me in discussing 10 horrible birth defects. Cyclopia is named after the one-eyed mythical giants from Greek mythology, and for a rather obvious reason. This birth defect occurs when the embryonic forebrain fails to complete one of its normal responsibilities, which is to divide the orbits of the eye into two separate cavities. This can be caused by genetic problems or toxins introduced into the body. Sometimes toxins are introduced into a pregnant woman's system when she ingests a poisonous plant that is easily confused with a healthy plant made to stop cramping and vomiting. This mistake can cause the brain to fail when splitting into two separate hemispheres and will result in the child being born with one single eye in the center of their head. Sometimes this comes accompanied with a tubular appendage for a nose somewhere above the eye, which was supposed to be a nose, but sometimes the nose is altogether gone. This defect often leads to the body naturally aborting the fetus and the baby being delivered stillborn. There have been few cases where the delivered babies were able to survive, but for a very brief time, before oftentimes suffocating to death. This defect is also seen in animals, in which its incidence impacts 1 in 16,000 born animals, while it affects humans at 1 in 250 embryos. Several well-preserved infants are currently on display in the Vrolijk Museum located in Amsterdam, as well as other various medical museums around the world. This unsettling defect is always fatal.
This defect is typically known as mermaid syndrome due to the fact that the legs are fused together to resemble a mermaid's tail. Affected infants are born with partial or complete leg fusion. This is often accompanied by other health problems, such as spine issues, gastrointestinal abnormalities, and heart problems. Certain parts of the body are sometimes entirely absent, such as the tailbone. The cause for this defect is currently unknown, and despite the best efforts of medical research, there is no visible rhyme or reason behind why an infant may be subjected to this condition. A theory is that the defect is a result of improper circulation during development. Unknown factors aside, what is known is that mermaid syndrome is often fatal. More than half of the cases result in stillbirth, and this condition is 100 times more likely to occur in identical twins. Due to malformation or absence of kidneys combined with other complications, newborns who are alive almost always die within hours. It is immensely rare to beat the odds, but some have. Experts believe only 3 people have survived with mermaid syndrome, one being a young girl that died at the age of 10 in 2009. This defect affects 1 out of every 100,000 live births.
Healing is an amazing function of the human body if you really think about it. However, some people aren't fortunate enough to have it. Fibrodysplasia ossificans progressiva, also known as FOP, is a connective tissue disease which presents as a mutation of the body's repair mechanism. When a child with FOP injures themselves and the body begins to repair the damage to the fibrous tissue, instead of healing the affected parts, it ossifies them, meaning that it grows bone in the affected areas. This condition can cause joints to permanently freeze in place and make life torturous for those affected. Avoiding damage is unfortunately not a solution, as this process can trigger spontaneously and without the victim having to injure themselves at all. Extra bone can develop around the rib cage and jaw, making it hard to breathe, speak, or eat, and malnutrition is a common result. If a parent is affected by this condition, their child has a 50% chance of inheriting it. Fortunately, this defect affects only 1 in every 2 million people worldwide. There is no cure or treatment for this condition, as surgery to remove excess bone only causes damage, which results in bone filling in the surgical sites. The life expectancy of a sufferer is around 40 years old, at which point the person's body practically becomes stone.
To be born missing a piece of your body would be devastating. Now imagine it being your brain. Anencephaly is a defect that results in the absence of a major portion of the brain, skull, and even scalp as a human embryo develops. As neural tubes form and close, this helps form the brain and skull of the fetus, along with the spinal cord and backbones. The upper part of the neural tube controls this development in the upper areas of the body, while the lower part of the tube controls the development of the lower areas. Anencephaly occurs when the upper part of the neural tube doesn't close all the way. The fetus then doesn't develop a forebrain, which controls thinking and coordinating. Any parts of the brain left are exposed. It's unknown as to what causes this defect to occur, and the infant will never be able to gain consciousness. Though the body may react to certain types of touch, these are only reflexes and do not make it any easier for a parent to decide to end what life the infant has. It's believed that over 1,200 pregnancies are affected by this defect each year in the United States.
When we think of parasites, we tend to think of creepy microscopic hellraisers, not possible siblings. But this defect, Craniopagus parasiticus, is also known as parasitic twinning. In this condition, a head of an undeveloped twin is attached to the head of a developed twin. The underdeveloped twin is referred to as parasitic because it is wholly dependent on its counterpart and substantially decreases the quality of life of the developed twin. Most cases end up as a stillbirth or die shortly after birth. Fewer than a dozen cases of this defect have been documented, with each case believed to occur in 4 to 6 out of every 10 million births. Only around 2 cases are known to have made it past birth and to surgery, and both died as a result of either complications during surgery or a severe brain infection after. When attached, the parasitic twins are often able to smile, blink, and sometimes cry. The cause for this defect is unknown, and research is limited due to the rarity of this condition. It has been claimed that one man, Edward Mordaki, sometimes known as Edward Mordrake, who was famous for this defect, lived to 23 years of age before committing suicide, claiming that his parasitic twin wouldn't stop whispering to him at night and tormenting him.
Some siblings are inseparable, whether they want to be or not. Conjoined twins, often known as Siamese twins, are perhaps one of the most well-known birth defects, as it is survivable in many cases and has had so much exposure in history, such as through freak shows. Around half of such cases result in stillbirth, which is substantially better than the odds of many other extreme defects. There is a somewhat higher probability of conjoined twins occurring in areas such as Southeast Asia, Africa, and Brazil. The term Siamese twins came from the most famous case of conjoined twins, Chang and Ang Bunker, who were born in 1911 in Thailand, which was then known as Siam. These twins traveled with P.T. Barnum's circus for many years where they were given this label. There are many different forms of conjoined twins where they are joined at different areas of the body. Sometimes they are fused at the abdomen, sometimes at the skull and other areas. Like so many other defects, and even despite its popularity, the cause for conjoined twins is still unknown, but it affects between an estimated range of 1 in 49,000 births to 1 in 189,000 births.
Known also as brittle bone disease, every day is a struggle and a risk with this defect. People suffering from osteogenesis imperfecta have bones that are abnormally prone to fracture, frequently due to abnormalities in the production of collagen. There are many varying types of this defect, ranging from mild cases to severe and lethal cases. A mild case is characterized by bones easily fracturing, loose joints, discolored white of the eyes, and possible hearing loss, to name a few symptoms. These symptoms become more definite and severe as the stages progress. Treatment varies, but sometimes involves inserting metal rods into the bones for extra stability, as well as trying to build bone mass to limit the bone pain associated with the defect. In mild cases, a person can live a full life, though with greater obvious risks involved. Unfortunately, a person doesn't only need to endure trauma to risk a fracture, their bones may simply break on their own with no apparent cause. This defect is more frequent than many, affecting 1 out of every 20,000 live births, and the cause is unknown.
The pain of a severe blister is usually unforgettable. Now imagine that being all over your entire body. Sufferers of epidermolysis bullosa, known as EB, suffer from connective tissue diseases that cause problems in the anchoring between the epidermis and dermis, which results in friction and extremely fragile skin. Because of this, the skin on the body often blisters and causes immense pain. Children that suffer from this condition are often labeled as butterfly children, because their skin is said to be as fragile as a butterfly's wings. It is believed that bone marrow transplants are an effective form of treatment, but due to the severe immunosuppression that such a procedure requires, this puts blisters at an incredibly high risk for infection, and therefore a number of patients die even preparing for the procedure. This excruciating defect is caused by problems with genes associated with skin formation. Mild cases may improve a bit as the person gets older, with more severe cases being apparent at birth when a baby simply crying can cause blisters to form on the vocal cords. These severe cases often result in death. This defect affects 20 per every million newborns in the United States.
The ribcage is meant to provide protection for the vital organs in the abdominal area. However, this isn't always how it works out. Ectopia cordis is a defect that causes the heart to be located either partially or completely outside of the thorax. But the heart may not be located just outside the chest where it should be, but sometimes it is found in the neck or other parts of the abdomen. Though in most cases, the exposed heart protrudes through a split sternum. The direct cause for this defect is unknown. Presented with this defect, parents are often advised to consider aborting the fetus. Because the condition is so uncommon, impacting only 8 per million births, not much has been developed in the way of treatment and repair. This, combined with the fact that most victims of this defect die rapidly after birth if they survived birth at all, do not offer much hope in terms of a prognosis. Though some cases have undergone successful surgical operations, the mortality rate remains very high.
Perhaps one of the most visually upsetting birth defects in existence. Harlequin ichthyosis, known simply as Harlequin baby, is a birth defect considered incredibly severe. This defect leads to the dermis being around 10 times thicker than it should be and causes it to grow very rapidly. The child, once born, is covered in thick white plates of skin, divided up by deep cracks. These deep cracks exist in places where normal skin would fold, and is easily infiltrated by bacteria, which will cause severe infections. Eyes, ears, genitals, and other appendages are often abnormally contracted. The cause of this genetic abnormality is unknown. It cannot be prevented, but is considered extremely rare. Oddly enough, this defect is survivable due to recent developments in medicine, though in the past it was considered always fatal shortly after birth. The longest surviving sufferer of this condition was born in 1984 and is still alive and in generally good health today.
That's all for now. Thank you for watching, and a very special thank you to Kaylee Elise for helping me host this episode. Be sure to subscribe to her channel, linked in the description below, where she posts fantastic videos on the creepy and bizarre, much like myself. And of course, if you want more creepy and bizarre topics from me, be sure to subscribe to my channel now, and I will see you next Wednesday.